Hello everyone, now let us discuss about general and specific criteria for category 1, 2 and 3 codes which come under CPT. First we will be discussing the general criteria for category 1, 2 and 3. There is general criteria and category specific criteria also. So all category 1, 2 and 3 code change applications must satisfy each one of the following criteria. The proposed descriptor is unique, well-defined, and describes a procedure or service that is clearly identified and distinguished from existing procedures and services that are already in the CPT code set. It must be unique, well-defined, and should distinguish from existing procedures and services. The second is the descriptor structure, guidelines, and instructions are consistent with current CPT editorial panel standards for maintenance of code set. Third point is the proposed descriptor for the procedure or service is neither a fragmentation of an existing procedure or service nor currently reportable as the complete service by one or more existing codes. The proposed descriptor for the procedure or service is neither a fragmentation, that is not a part of an existing procedure or service, nor completely reportable as a complete service by one or more existing codes, with the exclusion of unlisted codes. However, procedures and services frequently performed together may require new or revised codes. And the structure and the content of the proposed code descriptor accurately reflects the procedure or service as typically performed. If always or frequently performed with one or more procedures or services, the descriptor structure and the content will reflect the typical combination or complete procedure of the service. The structure and the content should reflect the procedure or the service. And if it is used typically with one or more procedure services, it should reflect the typical combination or complete procedure or service. The next is the descriptor for the procedure or service is not proposed as a means to report extraordinary circumstances. The descriptor for the procedure or service is not proposed as a means to report extraordinary circumstances related to performance of a procedure or service already described in the CPT code set. And finally, the procedure or the service satisfies the category specific criteria set forth below. These are the general criteria for all category 1, 2 and 3 codes. Now coming to category specific requirement. Now coming to the criteria for category 1 codes. A proposal for new or revised category 1 code must satisfy all the following criteria. First is all devices and drugs necessary for performance of the procedure or service have received FDA clearance or approval when such is required for performance of procedure or service. All the devices and drugs must receive FDA clearance. That is the first criteria. Second, the procedure or service is performed by many physician or other qualified healthcare professions across the United States. Third point is the procedure or service is performed with frequency consistent with the intended clinical use. That is, service for common condition should have high volume, whereas service commonly performed for a rare condition should have low volume. Next point is the procedure or service is consistent with current medical practice. And finally, the clinical efficacy of the procedure or service is documented in literature that meets the requirement set forth in the CPT code change application. The clinical efficacy is documented in the literature and that meets the requirement that are set forth in the CPT code change application. Now coming to criteria for category 2 codes. The following criteria are used by the CPT and HCPCA and the CPT editorial panel for evaluating category 2 code applications. First point is measurements that were developed and tested by national organization. Next is evidence-based measurements with established ties to health outcomes. Next is measurements that address clinical condition of high prevalence, high risk or high cost. Next is well-established measurements that are currently being used by large segments of healthcare industry across the country. In addition, all of the following are required. Apart from these points, above listed points, definition or purpose of the measures consistent with its intended use. The definition or purpose of the measure is consistent with its intended use, that is quality improvement and accountability, or solely quality improvement can be considered. The definition must be consistent with its intended use. Next is aspect of care measured is substantially influenced by physician or other qualified healthcare professional or entity for which code may be relevant. The aspect of code measured is substantially influenced by the physician. Next is it reduces the data collection burden on the physician. Those measure codes should reduce the data collection burden on the physician or other qualified healthcare professionals or entities. Next, it must be significant, that it affects a large segment of healthcare community and it is tied to health outcomes and it addresses the clinical conditions of high prevalence, high cost and high risks. It must be significant and it must be evidence based. That is, it is agreed upon, definable and measurable. Next is finally risk adjustment specifications and instructions for all outcome measures submitted or compelling evidence as to why risk adjustment is not relevant. Risk adjustment specifications and instructions for all outcome measures must be submitted, or there must be a compelling evidence as to why risk adjustment is not relevant. So these must be considered for category 2 codes. In addition to the previously listed criteria, category 2 codes must be sufficiently detailed to make it useful for multiple purpose. They must facilitate reporting of performance measures and inclusion of select patient history, testing and other process measures. It can be either cognitive or procedural service within the CPT or physiological performance, for example blood pressure, to support the performance measurements. The next is performance measure development process. The performance measure development process that includes nationally recognized expert panel, multidisciplinary and vetting process. So these are the criteria for category 2 codes. Now coming to category 3 codes criteria. Criteria for category 3 codes. The following criteria are used by the CPT, HCPCA, Advisory Committee and CPT editorial panel for evaluating category 3 code applications. The procedure or service is currently or recently performed in humans. The first point is the procedure or service must be currently or recently performed in humans, and at least one of the following additional criteria has to be met. The application is supported by at least one CPT or HCPCA advisor representing practitioners who would use this procedure or service. Next is the actual or potential clinical efficacy of the specific procedure or service is supported by peer-reviewed literature which is available in English for examination by CPT editorial panel. Next is there is at least one institutional review board approved protocol of the study of the procedure or service being performed. or a description of current and ongoing United States trial outlining the efficacy of the procedure or service, or other evidence of evolving clinical utilization. There must be these 3 points: at least one institutional review board approved protocol of the study of the procedure or service being performed, and there must be a description of a current and ongoing United States trial outlining the efficacy of the procedure or service. Either A, B or C must be there, or other evidence of evolving clinical utilization. These are the criteria for category 3 codes. By this we complete the general and the specific criteria for category 1, 2 and 3. Thank you for watching. Please subscribe for further videos on CPC and medical coding.